So this is an interesting approach to trying to understand the impact of a treatment over a longer period of time. The EXPAND trial was a randomized, double-blind, placebo-controlled study investigating whether siponimod versus placebo could prevent disability worsening in patients with secondary progressive multiple sclerosis. The study was set up so that participants had to be in the randomized control period for a minimum of 12 months. But thereafter, if they experienced disability worsening, they could go on to a open label extension study. So any participant who experienced confirmed disability worsening over a 6-month period of time would enter a open label observational study. And this means that the duration of follow-up for each individual is going to be somewhat different in the event that they experience disability worsening or not. After a certain number of disability events had been reached, the randomized control period was stopped. And so we have variable duration of data going anywhere between 12 months and 3 years for participants in the randomized control period. After that, the open label study continued for several years, and so we have data that goes all the way up to about 7 years of data. And the question, of course, is given that a lot of participants in the study transitioned from placebo over to active treatment, either during the randomized control period or at the end of the randomized control period study, once those individuals have moved on to active treatment, they tend to benefit from the active treatment, which is, of course, siponimod. And the question that we attempted to address in this study is whether we could model the performance of those individuals if they had continued on the placebo treatment. And so we used a number of statistical approaches to create a performance of the virtual placebo arm. And that data was presented for both the overall patient population as well as the active and non-active subgroups of individuals at the time of this conference. This approach utilizes a technique often used in oncology practices, but to my knowledge, this is one of the first times this has been applied to MS clinical trials. And if you look at the Kaplan-Meier curves for disability worsening, you can see that the virtual placebo group that we modeled has performance characteristics that are fairly convincing as to what might actually occur with the placebo arm. You don't see strange or bizarre behavior of this virtual placebo group. It does look like it is following the same line of the curve. And so I think that the results here are, of course, exploratory and interesting, but it suggests that early use of siponimod in secondary progressive MS could be associated with long-term improved beneficial outcomes. And that seems to be very consistent with the overall results of the EXPAND trial. And I think that this piece of additional data using a virtual placebo model helps provide further context in terms of the magnitude of response with siponimod versus no treatment.